Hello, everybody. My name is Katie Semmelroth, and I chose to do my special considerations project on exercise and Parkinson's disease. So, Parkinson's disease is defined by the Mayo Clinic as a progressive nervous system disorder that affects movement. The fact that it's progressive means that symptoms usually get progressively worse over time. Those with Parkinson's have low levels or are missing the neurotransmitter dopamine, which is due to the impairment of neurons in the brain. Parkinson's is the second most common neurodegenerative disease, just behind Alzheimer's, and it impacts approximately 1% of the population over 60, and 4% of those that have Parkinson's are diagnosed before the age of 50. There are many signs and symptoms of Parkinson's disease. Some are motor related, some are not, and then some are a mix of the two. Motor related symptoms include tremors, which can happen most often in the limbs, and it's due to a rhythmic firing of the nerves. Bradykinesia, or the slowness of movement. Rigid muscles, which often limits range of motion and can occur in any part of the body. Impaired posture and balance. Posture may become stooped or hunched over due to the unsteadiness a person may feel from standing completely upright, and balance problems are also likely to occur. There's also a loss of autonomic movements. People with Parkinson's may not be able to perform unconscious movements such as swinging their arms when they walk or even smiling, which can lead to a flat affect. There are also writing changes. It may become hard for a person with Parkinson's to perform fine motor activities such as writing, and their print may actually become smaller as well. There are also a variety of non-motor related symptoms, which includes a loss of smell, trouble sleeping, constipation, dizziness or fainting, vision problems, excessive sweating, mood disorders, and hallucinations. And then there are also mixed motor and non-motor symptoms, which include a change in the tone or loudness of a person's voice, drooling, or excessive saliva, and both of those are due to the fact that a person with Parkinson's may experience speech and swallowing problems. And then the picture on the right includes what a person may look like if they are presenting with some of these symptoms. So you can see the stooped over posture, they're shuffling the steps, there's rigidity in the muscles, and tremors, to name a few. While the causes of Parkinson's are not clearly known, scientists have identified some risk factors that appear to contribute to the onset of PD, including genes, environmental triggers, Lewy bodies, which are abnormal aggregations of protein that develop inside nerve cells, age, so the older a person is, the higher their chance is of developing Parkinson's, heredity, so if someone is closely related to you and they have Parkinson's, you will be more likely to develop it as well. Sex, research has shown that men are 1.5 times more likely to develop Parkinson's than women, and this may be due to the protective effect of estrogen or the fact that men are more likely to have experienced some sort of minor head trauma and are more likely to be exposed to environmental toxins. And then going off of that, exposure to toxins is also a risk factor. It can lead to the buildup of toxins inside the body, which could be a factor leading to the development of Parkinson's. So there's currently no cure for Parkinson's, but there are a variety of options to help those with Parkinson's manage their symptoms. One of the most common treatments for Parkinson's is medications. One of the most common is carbidopa-levodopa, and this is one of the most effective treatments. It's a natural chemical that passes into your brain, and once it's in your brain, it's converted to dopamine. The dosage and timing of this medication may be changed by a person's neurologist to adjust effects from the medication over time. Another common one is Duopa. This is a gel made up of carbidopa and levodopa, but this time it's delivered through a tube that goes directly to the small intestine, which may help with absorption of the medication. There's also dopamine agonists. These don't change into dopamine once they get into the brain, but they do mimic the same effects that dopamine has on the brain. Deep brain stimulation is also a treatment option. It's a surgical procedure where surgeons go and implant electrodes into a specific part of the brain. Electrodes are then connected to a generator implanted in the person's chest near their collarbone, and that generator sends electrical pulses to the brain, helping to reduce Parkinson's symptoms. This is usually used in people who are not responding to any medications or they're experiencing fluctuations in medications. However, this deep brain stimulation does not keep the disease from progressing. And then there are also lifestyle changes to help manage Parkinson's, including diet and nutrition, and then the biggest one being exercise. So obviously, exercise is so important for anyone to maintain good health, but it is particularly vital to those with Parkinson's in order to help slow the progression of the disease and help them to maintain a good quality of life despite living with the disease. According to Parkinson's.org, increasing physical activity to at least 2.5 hours per week can significantly slow the decline in quality of life for those living with Parkinson's. Exercise stimulates the production of dopamine in the brain from dopaminergic cells, which helps to reduce the symptoms of Parkinson's. And the earlier a person starts a program, the better. This is because it'll help them get into a good routine, making it a part of their everyday life. Some of the benefits of exercise for those living with Parkinson's include improvements in their gait and balance, flexibility and posture, endurance, working memory and decision-making, attention and concentration, and also quality of sleep. And they can also see reductions in falls, freezing of gait, and it also helps to decrease depression and anxiety. When looking at the brain specifically, there are a number of positive effects on the brain of those with Parkinson's, and that includes a better use of dopamine, the production of new blood vessels, improved brain metabolism, increased strength of synapses in the brain, and also the growth of new connections, reduced inflammation, and also the growth of new brain cells. So the type of exercise chosen for a person with Parkinson's really depends on the specific person. There are a variety of different types of exercise that have been shown to have great benefits for those with Parkinson's. Some of those, and the ones I'm going to talk about today, are flexibility, aerobic activity, resistance and strength training, Tai Chi, and then fitness programs such as Delay the Disease. So the first type of exercise I'm going to talk about is flexibility training or stretching. Stretching is really going to help to reduce muscle rigidity and improve that limited range of motion that you sometimes see with Parkinson's. The Parkinson's Foundation recommends those with Parkinson's disease to follow the guidelines that have been set by ACSM and also the American Heart Association, which are to perform at least 10 minutes of stretching at a time, and at the very least perform stretches 3 to 4 times per week, but daily is always better. And they also recommend that you hold stretches for 10 to 30 seconds and perform 3 to 4 reps per stretch. The picture on this slide is a picture of my dad who has Parkinson's, and he experiences a lot of muscle rigidity, so he tries to stretch every single day throughout the day in our kitchen, and it really helps with the tightness that he experiences due to the Parkinson's. The next type of exercise I'm going to talk about is resistance or strength training. This type of training can significantly help to reduce stiffness, slowness, and tremors in those with Parkinson's. This type of training will also lead to improvements in muscle and bone strength as it does for the general population. And one systematic review and meta-analysis of the literature found that moderate intensity progressive resistance training 2 times per week over 8 to 10 weeks can result in significant strength, balance, and motor system gains in people with early to moderate Parkinson's disease. And also, according to the Parkinson's Foundation, a strength training program should include the work of abs, quads, glutes, back muscles, and the triceps as well. Next, we're going to talk about aerobic exercise. So those with Parkinson's should aim to get 2.5 hours of weekly exercise, or 150 minutes. To achieve maximum benefits, though, their aerobic activity should be performed at a moderately high to high intensity. So some examples of good aerobic exercise include walking, jogging, and or running. Swimming, dancing has been shown to have great benefits for those with Parkinson's. Biking, water aerobics, and also chair aerobics as well. Tai Chi is also another type of exercise that has been shown to have great benefits for people with Parkinson's. Tai Chi is a form of exercise that's derived from Chinese martial arts, in which you sort of just flow through these slow, gentle movements, going from one pose to the next. According to the Parkinson's Foundation, it incorporates posture, mental focus, and deep breathing as the body is in constant motion. One study from the Journal of Physiotherapy found that in a group of Parkinson's patients performing Tai Chi 3 times a week, each session was an hour, for 12 weeks significantly improved balance and decreased their incidence of falls. So there are also a variety of fitness programs out there for people with Parkinson's disease. And fitness programs are a great way for people with Parkinson's to receive an individualized exercise program, socialize with others, and become motivated toward their goals. One fitness program in particular is called Delay the Disease, and it is an evidence-based fitness program designed to optimize physical function and help delay the progression of symptoms associated with Parkinson's disease. It's the #1 exercise program that fights Parkinson's, and it was actually started here in Central Ohio by a personal trainer named David Zid and a nurse named Jackie Russell, and they currently offer classes and programs across the country. Their exercise program is unique because it is evidence-based and targets specific symptoms of Parkinson's disease. So I hope some of the main takeaways you got from this is that Parkinson's is a progressive neurological disorder. The causes of it are mainly unknown, but there is some implication that it may come about as a result of genetic predispositions, minor head trauma experiences, as well as a buildup of toxins in the body. Treatment for it includes medication, brain surgery, but the biggest treatment is a lifestyle change, and specifically exercise. Exercise has been shown and proven to help significantly slow the progression of the disease. I know personally in my life, my dad was diagnosed with Parkinson's about 10 years ago, and the best thing that he can do to help combat some of the symptoms and challenges that he faces is by implementing exercise into his everyday life and just getting his body moving. So lastly, my test question is, which of the following is not a proposed risk factor for Parkinson's disease? And the correct answer would be ethnicity. And here's my works cited. Thank you for listening to my presentation. Have a great rest of your day and rest of the semester.